When a woman keeps trying but pregnancy doesn't occur, an unsettling worry often takes over her heart and mind. The constant question arises: what's wrong, and what can be done to receive the good news sooner? The truth is, there can be many reasons behind delayed conception, but by adopting certain habits and precautions, the chances of pregnancy can increase significantly. The very first step is to improve lifestyle. Eating a balanced diet rich in fruits, vegetables, proteins, milk, and essential vitamins strengthens the body and helps maintain hormonal balance. Light exercise, proper sleep, and peace of mind are equally important, since stress itself is one of the leading causes of infertility. Maintaining a healthy weight also plays a major role. Being overweight or underweight can both make conception difficult. There are also other important factors to consider. Harmful habits like smoking or drinking alcohol should be avoided completely, as they affect fertility in both men and women. Another crucial aspect is the right timing of intimacy. Around 12 to 16 days after the start of a woman's menstrual cycle, ovulation occurs, and these days are the most favorable for conception. Intimacy during this fertile window greatly increases the chances of pregnancy. However, if after 6 months to a year of consistent effort there is still no success, it's better not to delay and instead consult a gynecologist or fertility specialist. Sometimes the issue may be related to hormones, ovary or uterine health, or even male infertility. The good news is that with medical guidance, many of these problems can be treated effectively. Above all, remember that this phase requires patience and positivity. Don't let despair take control. Approach the journey with hope, healthy habits, and the right guidance. With the will of God, good news can come sooner than expected,